Understanding leptospirosis, a hidden threat. Leptospirosis is a bacterial infection affecting humans and animals worldwide, caused by leptospirobacteria. These spiral-shaped bacteria are highly adaptable and can infect a wide range of hosts, including mammals, birds, and even reptiles. The disease is more common in tropical and subtropical regions, but it can occur anywhere, especially in areas with poor sanitation and high rainfall. These bacteria thrive in warm, moist environments and can survive in contaminated water or soil for weeks. They are often found in stagnant water, such as puddles, ponds, and slow-moving streams, as well as in wet soil. The bacteria can enter the body through cuts or abrasions on the skin or through the mucous membranes of the eyes, nose, or mouth. Leptospirosis is zoonotic, meaning it can be transmitted between animals and humans, often through contact with contaminated water or soil. Pets, especially dogs, are at risk of contracting the disease if they drink or swim in contaminated water. Livestock, such as cattle and pigs, can also be carriers of the bacteria, posing a risk to farmers and others who work with these animals. Outdoor activities like swimming, hiking, or camping in areas with poor sanitation increase the risk. People who participate in water sports, such as kayaking or rafting, are also at higher risk, especially in regions where leptospirosis is endemic. It's important to be aware of the potential dangers and take precautions to avoid exposure. Climate change, with frequent heavy rainfall and flooding, creates favorable conditions for the bacteria's survival and spread. Floodwaters can carry the bacteria over long distances, contaminating new areas and increasing the risk of infection. As climate change continues to alter weather patterns, the incidence of leptospirosis is expected to rise, making it even more important to understand and prevent this disease. Understanding leptospirosis is crucial for protecting yourself, your family, and your pets. Preventive measures include avoiding contact with potentially contaminated water, wearing protective clothing and footwear when engaging in outdoor activities, and ensuring that pets are vaccinated against leptospirosis. If you suspect that you or your pet may have been exposed to the bacteria, seek medical attention promptly. Early diagnosis and treatment are essential for a successful recovery. Researchers are continually working to better understand leptospirosis and develop more effective treatments and vaccines. Advances in diagnostic techniques are helping to identify the disease more quickly, which is crucial for controlling outbreaks and reducing the impact on affected communities. Public health initiatives play a vital role in raising awareness about leptospirosis and promoting preventive measures. Education campaigns can help people recognize the symptoms of the disease and understand how to reduce their risk of exposure. Community efforts to improve sanitation and manage water resources are also essential for preventing the spread of leptospirosis. Maintaining a clean and hygienic environment is another important step in preventing leptospirosis. Regularly cleaning and disinfecting areas where pets and livestock are kept can help reduce the presence of the bacteria. Proper waste disposal and pest control measures can also minimize the risk of contamination. Vaccination is one of the most effective ways to protect against leptospirosis. Vaccines are available for both humans and animals, and they can provide significant protection against the disease. It's important to follow vaccination guidelines and ensure that pets receive their shots on schedule. Recognizing the symptoms of leptospirosis is crucial for early diagnosis and treatment. In humans, symptoms can range from mild flu-like signs to severe illness, including high fever, headache, muscle pain, and jaundice. In severe cases, leptospirosis can lead to kidney damage, liver failure, and even death. If you experience any of these symptoms after potential exposure, seek medical attention immediately. In animals, symptoms of leptospirosis can include fever, vomiting, diarrhea, and lethargy. If your pet shows any signs of illness after being in a potentially contaminated area, take them to a veterinarian as soon as possible. Early treatment with antibiotics can be very effective in managing the disease and preventing complications. Community involvement is key to controlling the spread of leptospirosis. By working together to improve sanitation, manage water resources, and educate others about the risks and preventive measures, we can reduce the impact of this hidden threat. Everyone has a role to play in protecting themselves and their communities from leptospirosis. With the right knowledge and precautions, you can continue to enjoy outdoor activities while minimizing the risk of leptospirosis. Stay informed, take preventive measures, and encourage others to do the same. Together, we can make a difference in the fight against this hidden threat. The silent spread transmission and risk factors. Leptospirosis spreads silently, often catching individuals off guard. Infected animals, particularly rodents, shed Leptospira bacteria in their urine, contaminating water, soil, and vegetation. Humans and animals can contract leptospirosis through direct contact with infected urine or contaminated environments. Activities like swimming in contaminated water or handling infected animals increase the risk. Proper hygiene and protective measures are essential for those in high-risk occupations like farming and veterinary work. Recognizing the enemy symptoms in humans and pets. Leptospirosis often mimics other illnesses, making early diagnosis challenging. In humans, it typically presents with flu-like symptoms such as fever, chills, headache, and muscle aches. Severe cases can lead to meningitis, liver or kidney failure, and respiratory distress. Dogs show similar symptoms, including fever, lethargy, vomiting, and jaundice. Recognizing these signs is crucial for seeking timely medical attention. The crucial diagnosis: unveiling leptospirosis. Diagnosing leptospirosis requires clinical suspicion, patient history, and laboratory testing. Early diagnosis is essential for initiating appropriate treatment. Blood and urine tests, along with serological tests like the microscopic agglutination test, MAT, help confirm the diagnosis. PCR testing can detect Leptospira DNA in early stages. Culture of the bacteria from blood, urine, or cerebrospinal fluid can also confirm the diagnosis, but may take weeks. Combating leptospirosis relies on antibiotics and supportive care. Penicillin and doxycycline are commonly prescribed antibiotics. Early administration of antibiotics is crucial for effectiveness. Supportive care includes intravenous fluids, pain relievers, and antipyretics. Severe cases may require hospitalization and specialized treatment. Early recognition and prompt management of complications are crucial for improving outcomes. Modern medicine continues to make strides in the fight against leptospirosis. Researchers are exploring immunotherapy, new antibiotics, and improved supportive care measures. Monoclonal antibodies could prevent bacteria from attaching to host cells. New antibiotics aim to be more effective and reduce side effects. Biomarkers and new technologies like extracorporeal blood purification are being explored. These advancements hold the potential to revolutionize the diagnosis, treatment, and prevention of leptospirosis. Prevention is the most powerful weapon against leptospirosis. Minimize exposure to contaminated water and soil, and wear protective clothing if contact is unavoidable. Prevent rodent infestations by keeping environments clean and sealing entry points. Vaccination is crucial for animals at high risk of exposure. Vaccines are available for dogs, cattle, and pigs. Consult with a veterinarian for the appropriate vaccination schedule. Vaccination stands as a crucial shield against leptospirosis. Vaccines stimulate the immune system to recognize and fight Leptospira bacteria. Vaccinated animals are less likely to become infected and shed the bacteria. For dogs, vaccination is recommended for all, with booster shots as advised by a veterinarian. No vaccine is 100% effective, so maintain other preventive measures. Minimize exposure to contaminated water and soil, and control rodent populations. The journey through leptospirosis is often arduous, marked by uncertainty and challenges. Meet Sarah, whose life changed after a camping trip. She experienced severe symptoms and was diagnosed with leptospirosis. With support from loved ones and medical care, she embarked on a long recovery journey. Sarah's story is one of resilience and hope. Her determination and support system were crucial in overcoming the illness. Life after leptospirosis involves managing long-term health challenges. Fatigue is a common long-term effect, impacting daily activities and quality of life. Kidney damage may require regular monitoring and lifestyle modifications. Liver involvement can cause fatigue, jaundice, and abdominal pain. Regular monitoring of liver function is essential. Ongoing management and support are crucial for those with persistent symptoms. A hopeful future emerges through relentless research on leptospirosis. Rapid diagnostic tests are being developed for early detection. New vaccines aim to provide broader protection against more Leptospira strains. Novel therapeutic agents like monoclonal antibodies are being explored. Blocking key virulence factors could prevent infection and reduce disease severity. These advancements promise better diagnosis, treatment, and prevention strategies.